And please be assured that all ministers and all the participants who have requested to take the floor will be given the floor to read out their statements and share with us their thoughts and ideas.
Thank you very much.
Minister of Malaysia, please, you have the floor.
Thank you very much. Can you hear me?
Yes, please.
Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh, and good evening. My name is Khairy Jamaluddin. I'm the Minister of Science, Technology and Innovation for Malaysia. Thank you very much to UNESCO for hosting this very, very important dialogue tonight. Malaysia is currently implementing a movement control order to curb the spread of COVID-19 in our country. Now, this movement control order was established on 18th March and will last until 14th April, subject to, of course, further developments. This is our strategy to suppress and to ensure that we can flatten the curve. During this time, only essential services are allowed to operate with limited outdoor activities. And it's very important that for policymakers to lift this or to extend this, it must be based on science and epidemiological facts. So we must make sure that the science is at the forefront of ensuring that we make the right decisions as far as population movement is concerned. Other than that, we have increased our diagnostic lab capacity, and we've done whole genomic sequences to ensure that we can deposit this to study mutations for the development of vaccine.
I'd like to raise 3 points briefly. The first is with regards to the repository of information. Now, I support the calls to have a central repository for research. I'd like to extend this to technology and innovation as well. If we look at the situation today, many countries and corporations are racing, not just to look for vaccine or antiviral developments, but also they are reverse engineering innovation, breathing aids, ventilators, personal protective equipment, consumer health products, in order to better cater for people around the world and of course for their populations themselves. Now, how are we sharing these resources? It's times like these where quick information saves lives. So I think it is worth considering utilizing a shared repository, not just of medical research, scientific research, but also the commercial and industrial innovation and technological developments that are taking place. Every day I read about people developing reverse engineering to come up with new solutions to manufacture ventilators. And this is something that we really need on a real-time basis to study what works and what doesn't work, to see whether or not we can scale it up in our own countries. Secondly, when we are synchronizing epidemiological models regressed by health professionals together with big data analytics provided by our mobile data providers, this allows for a fairly high level of accuracy, specifically in contact tracing. And I can't stress enough the utilization of technology in contact tracing. Now, we are trying to create an application in Malaysia, and some other countries have rolled this out, where we can contact trace and quarantine ring fencing of people under suspicion, especially after we lift the movement control order. But of course, that kind of high-level predictive technology has its privacy issues as well. And this is something that we can share our experiences in our respective countries about how these models are relevant and how much we move into the personal and private domains of individuals. But more importantly, I think, is for us to ensure that the central repository includes some of these open source codes for contact tracing applications and technologies, because once the curve is flattened, that's not the end of COVID-19. We have to ensure that we have the technology to ensure that contact tracing continues until, of course, there's a vaccine, and until, of course, we can bring the rate of infection to a suitably low level. So I think contact tracing technology is very, very important.
Third, I think there is the issue that policymakers going forward have to balance is the availability and speed of COVID-19 tests with the level of accuracy that is needed. Now, rapid tests for antibody detection that allows more people to be tested at any given time, which means more people can be identified as carriers, past infection, or ruled out completely. But these tests aren't necessarily the best for early detection. At the level of accuracy in some of these tests are not the same, as we all know, as the RT-PCR test, which is the gold standard. So when you are going up the epidemiological curve, as opposed to coming down, the price of type 1 errors, which is false positives, will mean crowding out of medical space, resources to population segments that need it the most. So anything that we can share together about rapid test kits, about test kits that will not end up
throwing up a lot of type 1 errors and therefore taking up resources that are sorely needed by those who require them, will be appreciated to be shared on a UNESCO platform. And finally, the preparedness post-COVID-19. I think this is not going to be the last pandemic. We need an approach towards broader science. Social science, data science, behavioral science come together to offer solutions for us. There is a tendency for us to retreat at this point, but I hope that we can reach out and help everyone around the world. Malaysia is with all of you, and we are supportive of UNESCO's Open Science platform. Thank you very much.
Thank you very much, Minister. Thank you.